So I'm just here at New Park Clinic and I'm here with Dr. O'Donnell. I'm going to run through some questions that I got. So the first one is, how much do they cost? So
braces vary tremendously because the number of problems that people can have with their teeth vary. So for instance, if a person has one tooth in crossbite, which means that one of their upper teeth is trapped behind the lower jaw, that can be €500 just to correct the bite. If someone needs a little expansion as we fix the bite, it might go up to €800. But then we have and then there's a severe range of issues that can occur, and it might need 2 to 3 years, and that will be right up to €5,000. So there's a complete range of prices.
it is probably best that you pop into New Park Clinic for a free consultation, because here Dr. O'Donnell will have a little chat with you about the price ranges and what it is your teeth actually need and how long they need. So yeah, pop in for a free consultation. So the next one is, can kids get Invisalign?
Yes, the good news is now there is a product specially designed for 6 to 10 year olds. So if your 7 or 8 year old has front teeth that they're very unhappy with, rather than wait till they're a teenager, we now have a product. So we can design a plastic aligner that will get the 4 adult top and bottom teeth really straight, get the smile width corrected, and hopefully they need very little, if anything, as a teenager.
Next one is, what are the difference between Invisalign and Traintrox, and are the results the same?
Results should be exactly the same whether you use Traintrox or Invisalign. Invisalign, if correctly designed, will get you a superb result. So with Invisalign, 2 crucial things: it needs to be designed correctly by the orthodontist, and it needs to be worn perfectly by the patient. A really good design will not work if it's not worn, and consequently, if it's designed not by an orthodontist who is highly trained in designing braces and they're worn correctly, you can get an absolutely superb result. There are actually a number of bites that respond slightly better to Invisalign. So if someone's front teeth don't meet because of thumb sucking, that's a really good. And the second case would be, traditionally headgear was a type of contraption where you would reverse the back teeth to make upper front teeth look less prominent. Now we can do that with Invisalign, nothing outside the mouth, and we can retract the form. At the end of the day, we will discuss with each individual what is going to fit them and their lifestyle. And if children are randomly playing different sports, home late at night, fixed braces may be the way to go. And if someone is super organised and regimental, Invisalign is a dream.
Next one is, my 7-year-old's teeth seem to be going crooked, and is he too young for Invisalign?
The ideal age to see a patient is 7 to 8 years. That's when the front, upper and lower adult teeth have started to grow. We have enough information at age 7 to predict what the future growth will be. So we can assess missing teeth, extra teeth, cross bites, and carefully check how the lower jaw is growing. And if it needs a little push forwards, the optimum time is to do that. The optimum age is between 8 and 10 years for us to treat that and make upper teeth look less prominent and encourage the lower teeth to move forwards. And one other advantage is seeing someone when they're actively growing and they're going through their growth spurts. We have different treatments that can avoid extraction of adult teeth when you see them when growth is completely ended, and then we're very limited in what we can do to retract